In other news, Biogen today presented detailed data on its resurrected experimental treatment for Alzheimer's, a disease for which there is no cure. And that's why today's highly anticipated presentation got a lot of attention. But in the end, analysts had a hard time parsing through the new information. Meg Tirrell has more.
Developing new medicines is hard for any disease, but the track record is particularly bad for Alzheimer's.
It's been about 15, 16 years, more than a decade, since we've had a new treatment that's been approved for Alzheimer's.
So word that the first drug to potentially slow down the loss of memory and ability to function that come with Alzheimer's was greeted with excitement, both by the medical community and by Wall Street. Drug maker Biogen made the news in October when, armed with new data, it said its thought to be failed Alzheimer's medicine may actually work. Today, it presented that information for the first time at a scientific conference. Afterwards, panelist Dr. Sharon Cohen, who helped run the Biogen trials, weighed in on what they might mean for patients.
You're talking about people at a mild stage of disease still being able to work, bank, shop, travel, enjoy leisure activities for longer.
But there's a lot of skepticism about the drug because the results of Biogen's 2 clinical trials are anything but straightforward.
One study really worked really well, and when you look at that data, there was a clear disassociation of the curves, meaning the placebo did one thing and the active arm did another, and that was really positive. And then there was the other study, which is called Engage, which didn't exactly work, and that still remains complicated.
Biogen stock rose today as the company still plans to file for regulatory approval early next year. That'll put the decision in the hands of the FDA. And with more than 5 million Americans living with Alzheimer's, those in the research community are hopeful the renewed focus on Biogen's drug may spur momentum across the space.
Today, there are over 130 ongoing clinical trials in Alzheimer's and dementia research, testing a variety of approaches. And I think that's one of the things we've seen in the last 5 years is really a diversification of those approaches that are going forward.
Progress couldn't come soon enough. For Nightly Business Report, I'm Meg Tirrell.